Hello, hello, everyone. Hello. Welcome to Urban Renal Talk with Tamika and Steve. I am your host, Steve Belcher. Tonight, we got an exciting show for you tonight. I'm just waiting for my partner. She's a little under the weather, but we're going to start the show. Like I said, this is an exciting show tonight. We're going to talk about what safe dialysis is. Tonight, one of my guests of two is Tiffany Hawkins, patient certified hemodialysis technician here in Baltimore, Maryland, at one of the local dialysis facilities. Hi, Tiffany. Thank you for coming on Urban Renal
Hey,
Talk. How's everything going tonight?
it's going fine.
It's going fine.
Yeah,
Did you work today?
not today, but I go in
Okay.
tomorrow.
Oh yeah.
Yes.
Right, right. So look, we're just going to get this show started, Tiffany, because the topic tonight is what does safe dialysis look like? And before I start the show, I just want to read a statement to our viewers. Um, this show tonight is not about placing blame or condemn the dialysis clinic or caregivers who work long hours and give quality care. Needed someone else to help you while getting treatment because the center was understaffed. I had 46% of the people say yes, and I had 50%, I'm sorry, 54% that said no. Even though there was more people that said no to this, however, you can't discount the 46% of the people who said yes, that um, they needed someone else to help because the center was understaffed. Have you ever in your career, have you ever experienced this type of situation where uh, the center, wherever you worked in your career, was understaffed, and that it was hard to fulfill some of the patient's needs at a time in a timely manner?
Yes.
You have.
We have. Yeah. hmm
What would you contribute that to?
Like, people call out, and you can be understaffed from people, calling out from work.
Uh
But
huh.
but when you work in a center where you have a team, people can pull together to make sure that the patient's still getting the quality care that they need from us.
Right. Exactly. So I did a another poll yesterday, September the 26th, and my partner should be coming on shortly. But I did a another poll yesterday, and this was an exciting. This was interesting. This poll, I said, if you receive kidney dialysis treatment, do you feel you receive safe dialysis care? Um, 25% people said yes, and 75% of the people said no.
Wow, that's a lot. That's a lot.
So that's why I said this topic is so important because you have 75% of the people who participate in this poll said they don't feel safe receiving care.
Why did they say why, or they just well, what was their
Well,
reason for not feeling safe?
it wasn't no reason, but I definitely got some. And let me tell you, there was an article done um, maybe several years ago by the Washington Post, or it was a Washington magazine, and it was called Dialysis Scams. And these were 8 complaints that rung out. Patients' treatment were shortened due to lateness, which may not be of their fault, meaning they may have missed the bus, medical reasons, or other problems. Two, fruit flies and gnats due to possibly biofilm in the drain system. 3, bed bugs. 4, patients not properly being monitored, i.e., staff on cell phone or not in the area to see the patients directly. 5, being belittled or disrespected. 6, staff not washing their hands between patients. 7, staff not responding to machine alarms in an appropriate time frame. And 8, patients who may have issues with post-bleeding move to the side and another patient may be put on that machine.
All that.
I mean, do you think those are valid complaints?
They're valid, but
Uh-huh.
as attacked and being attacked for like over 20 some years, you see a lot,
Okay.
but it's this younger generation, and I hate to say this, like those of us that have been in the dialysis community or for years, since a long time, we know how to really take care of our patients. It's these new generation of techs that they're allowing to just come in, don't really know what it is to really care for a patient,
Mm-hmm.
because a lot of them are just there because they want this paycheck or they just want to make that money. They're not really caring about what you're doing. You're every day that them patients come in, that's another day that they get a chance to live. And you have to look at them, like that, because if it wasn't for us, they wouldn't be here.
Right, right, absolutely, absolutely. When you say new generation, what do you mean in specific?
These younger, not younger, but these newer techs don't understand. Like they just look at it as just being a job. We've been there. We've seen, a lot of things. We know the ins and outs of dialysis.
Mm-hmm.
You can educate a person, but are they really getting the education to know what's really, happening or what's really going on?
Right, right, right. I was looking for a paper. Patient out in California wrote her name is, gosh, um, Barbara Grant out in California, out in Oakland. So
Hmm.
she did a dialysis checklist because um, she says that she says, what does safe dialysis look like? Because patients get used to the same routine that they think that they're getting good care when they may not be. So she
Right.
came up with this dialysis safety checklist, and I just want to ask you, from your perspective, do you think uh, this checklist is um, is practical?
Hmm.
So on this checklist, it has more or less like 3 um, um, overall goals, and then it has like sub things below it. So, for instance, the number 1 is scale and pre-treatment. A caregiver escorted me from the lobby to the scale to check my weight. Yes or no? Then gave assistance to patients who cannot walk on their own. And C, caregivers made sure I removed all heavy clothing, bags, or other items before stepping on the scale. Pause for this one. Is that practical to do for a lot of the patients given this day and time of dialysis
I
care?
don't mean I don't mean to interrupt you, but you went out, like it went blank,
Oh yeah,
so
I
I
know.
didn't really get to hear your question. I didn't get
Okay.
to hear you.
Okay. So I'm sorry about that. So on this dialysis safety checklist, it has number one, scale and pre-treatment. So it has several
Mhm.
items regarding that. The first one says a caregiver escorted me from the lobby to the scale to check my weight. Then B, caregivers gave assistance to patient who cannot walk on their own. And C, caregivers made sure I removed all heavy clothing, bags, or other items before stepping on the scale. Is that practical?
It
And
should
to,
be practical. This is what we supposed to do
right,
as a tech.
right, but given this day, um, dialysis, this 21st century,
Mhm.
and the way how they have treatment, is that happening? I mean, are for instance, during your career, do you see all caregivers going out there assisting patients that need to
No,
be assisted?
see all. I don't
I'm
see all.
sorry,
I don't see all.
you don't see all, right?
Mm-mm.
Okay, so number two, during treatment. This is part of that checklist. It says a caregiver check my vitals before beginning treatment. Now, as a caregiver myself, I do see that.
Mhm.
Um,
I see it.
Patients were checked on regularly, and patients' calls were quickly answered. C. The clinic had the medication I needed to address treatment side effects. So, I mean, is a lot of that practical as well?
Yes.
Far as patients were checked on regularly and patient calls. I mean, I know this, this is going on that patients are being checked regularly, but on the other hand, you have some patients that say that they haven't had their blood pressure checked in an hour, or they may want to get the attention of the caregiver and they couldn't get it. I mean, have you ever
Mhm.
witnessed that? I mean,
Mm,
in your career?
well, yeah, I have said it. The impression not being checked in an hour, cuffs go off automatic hour. So maybe the patient and didn't know that the person came over and actually checked their vitals. You know what I'm saying? So
Hmm.
I really can't on the blood pressure part because I know we check a blood pressure every half an hour.
Okay. Okay. Um, this last part um, of the safety list in the treatment, and I can speak from this point, but before removing needles from my access point, the nurse rechecked my vitals, asked me questions, and listened to my response.
That's logical. Oh,
Right.
that's practical.
Hmm. Even though it's practical, but does it happen all the time?
I I only can speak from my experience. Yes, it does. It happens all the time.
Okay. Okay.
I've never seen nobody not check somebody's vitals before taking their needles out.
Okay. It may look like
Not
a
saying that it might not have happened, but I have never seen nobody just not take a person's vitals and remove their needles.
okay. Now I had my camera blacked out, so if it looks like I'm not on screen, I'm still here, but something went on with my camera, so I just wanted to let you know that.
Okay. Okay.
So, um, now another part of this checklist, it talks about a safety checklist. Um, Okay, so this is a continuation. The end of treatment. The clinic gave me bandages for my access point. and or other medical supplies I needed after treatment. I mean, do a lot of the facilities do that? Give patients bandages to go home with?
Yes.
Really?
Yes.
Okay. Okay. Um, have you seen that in all the facilities you work, or just some?
Some, not all, but some.
Okay. Another issue, well, a part of this checklist was the transition time. And the first one says, I felt ready to go physically before I left the dialysis station. C, bleach and other cleaning solutions were used to sterilize the dialysis station between patients. And C, clean stations and chairs were dry before I sat down. Um, do you think that that's an issue in any of the facilities you worked at?
What, like not cleaning the machines or cleaning the machines? I'm trying to understand.
Well,
You
clean
know,
the machines, but wait to they're actually dry before the patient sits down.
yeah, you should. Well, yeah,
Uh
yeah.
huh.
You wait for the chair to be dry before the patient actually sits down, but we shouldn't be cleaning machines while while a patient is still sitting in a chair.
Well, let me share my experience um, with this in my career. Is I have seen individuals wipe the chair down and not even wait till the chair dries and throw a sheet on it and
Oh, okay.
hurry to back
Mhm.
to the chair. I mean, I'm just speaking truth of my
Right.
experience of
Mhm.
what I've seen, but it does happen. Um, Another thing that I've seen in my experience pertaining to the transition time is where it says I felt ready to go physically before I left the station. And as a nurse, I've seen well, I've been in situations and seen um, caregivers try to kind of hurry the person out per se to get the next person on. And I don't blame the caregiver for that. I blame the management of the facility and the environment that they create to cause this
Mhm.
to happen. Um, what do you think?
Management, it's all in the staff. Well, the management is who controls the staff is who makes the clinic. You get what I'm saying?
Okay,
Because we're the ones that's given the direct patient care. Managers don't usually work on the floor. They're in their office. But the
okay,
staff is the ones who actually work on the floor.
right,
So,
okay. So Tiffany, now let's just I just want to ask you, as a caregiver, can you just share some of the um, stress that you may encounter or challenges in this particular job from a caregiver's perspective? I know you had mentioned one of your patients had
passed
passed
away.
away within the
Yeah.
last 2 weeks. Can you just share with our viewers uh, your experience with that and how it affects patient caregivers on a whole?
Well, with a patient caregiver, you tend to become close with your patients because you become like family to them because you're dealing with them day in and day out. And I'm with them. I'm seeing that I'm at work with these patients more than I am with my own family. You know, so you tend to become very close, and then when a patient passes away, it kind of hits you, you know, it hits you to the core. At least it does with me, and a lot of times when certain things go on, or when a patient passes away, or what they pass away from, and then is other patients, why the patient, what happened to the patient. I think more patient education should come in when certain things arise. Like they should be taught over again. These are the things that you need to do in case certain things arise. You understand what I'm saying?
Yes.
Like, and I think a lot of times patients are not really educated, know what to do in a crisis once they leave the center. You know what
Okay.
I'm saying? So, I just think, like, with things that's going on with this staff, patients, it still should be a thing where they're educated. Not just come to dialysis, been there, but the education is not reinforced to.
Why do you think the education is not being reinforced?
I'm saying I think it should be. I'm not saying that, like, when I'm saying when certain crises happen,
Okay.
like patients are getting educated, but I'm saying when certain crises happen with other patients, whether it be in the center or outside when they go home, patients should be re-educated as to knowing what should be done or what they can do
Okay. Got you.
to
Got
help
you.
themselves. You understand what I'm saying? Like,
Absolutely.
yeah.
Okay. Let me ask you this
So
far
if
as
you have a scenario, if you go home and so like you at the clinic and we apply the dressing, we apply pressure, you stop bleeding, we take you up, you go home. You done had dinner, you done took your bath or whatever it is that you've done, got yourself together, and then all of a sudden you have a breakthrough, bleeding, a bleed out. You're starting to bleed out. Do
right,
patients really
right.
know in a crisis like that? Do they know that if they see themselves bleeding and they home by themselves, they should apply pressure to their access? Do they
Okay.
actually know that? Do they know that they should call 911 when a crisis like this arises?
Okay. Absolutely. I
Do you know that when you don't feel good and you really don't feel good, there's hospital? Because it could be something else. Let them check you out just to make sure you are okay before you say, "Oh, I'm sick. I'm just sick and I'm just going to miss a day from treatment." Why not go to the hospital?
right.
A
Do
lot of things
it,
probably can be prevented if we reinforce education when crises arise.
right, right, right. Uh, is that a issue that you see um, with patients receiving dialysis that a lot of them miss treatment and don't go to the hospital because they may feel sick and they may stay home
Right.
instead of
They
going to the
may stay home,
hospital?
but then when they're told that they should go, but if they knew the importance of why you should go, then maybe they would go more. You know what I mean? So I
Okay.
think patient education is a must.
Okay.
That they should be
Okay. Let me ask you, do you think that there's enough time in dialysis units today setting to do patient education?
yes. Why wouldn't it be? They on the machine for 3 to 4 hours. Education could be done. You can hand out paperwork. You know what I'm saying? A tech can educate a patient. You understand what I'm saying? But the charge nurse may be busy. But if the paperwork, you know what I'm saying, is like put out, or somebody takes charge and put out that paperwork, they can educate. A tech can deal with their 3 patients and
Okay.
educate them one on one.
Okay. I have a question, and I don't know if you may know this or not. So I know situations change, but how long is the normal training program for each new hired caregiver?
It's usually 12 weeks or longer, depending on the person and how comfortable they feel.
Okay, okay. Now, when you mentioned earlier about the new generation, um, is there an issue with training when it comes to the new generation?
It's not the training, it's the compassion, the love. It's what how we were brought up. How we were brought up to to love and care for people more than this younger, the younger or this generation now.
Okay, okay,
Age has, to me, that's me personally, has a lot to do with it. But if a new generation of a person comes in, if they are taught, maybe they need to be taught to be compassionate. They may need to be, because some of us, it just comes natural.
okay, okay.
Because like that saying always saying, dialysis is not the way it used to be.
Oh, you're right about that. You're right. I remember
Mhm.
we used to be able to sit down and
Mhm.
talk to patients and do education like that. There wasn't no rush mentality environment to
Right.
hurry up and get them on, get them off. Um, you're right. You're absolutely right with that. Um, do you think the companies know this, far as with the hiring of this new generation and the lack of empathy and care that may be given to patients? Do you
Probably
think they?
not, because anybody can put on, when they want a job, anybody can put on a good show because they want to get hired. I mean, you know what I'm saying? You really don't
Yeah.
know until after you've hired them, and then they've been there.
Okay. Okay.
Like you tell patients, if you have a problem, then you can speak up and talk about that problem and go to your clinical manager and let them know how you feel. They don't know how you feel unless you tell them.
Wow.
Excuse me. You know,
So now I have gentleman Donnell Carley. He's from Georgia. He says the state of Georgia requires at least 6 months of training, but all need to be trained, but must have a RN proctor aiding them.
that's how it is here in Maryland now. You have to have an RN preceptor now.
Really?
Techs can't train. I know it's like that with the company I'm working for. You have to have a RN preceptor. You can't train a tech. And as far as being, you talk about the Russian mentality. What I work at, we're not doing that now. No, they're
Okay.
giving us, we get 45 minutes in between our group of patients to get them on and to get them off the machine.
Okay. Okay.
So we're getting more one-on-one, not rushing with each patient. We're getting more time in between our patients to put them on and get them off the machine so that we can patient at a time.
Right. Now, that generally doesn't happen in all facilities, does it?
I I don't know. I just right now I'm just working in one.
Okay.
Hmm.
Okay. Yeah. Do you think they the possibility of like putting on one shift at a time, and then once the first shift finished, just finish the first shift before you start putting on another shift for patients?
It's funny. A coworker of mine, we were talking about this the other day. That I think that we should have time to put on first shift, move them out, and have a certain time that second shift starts to get put on. and so forth with, with third shift. I mean,
Okay.
that way it won't be like so much confusion, and then patients is complaining because they don't feel like they getting on in a timely manner. We have some patients who will chew and bite our heads off because they
Right.
don't feel like we're moving fast enough.
And what would you say to that, to someone who starts complaining because they feel
Get,
like you're not moving fast enough?
I personally, if it's happening to me, if I'm running behind, I go to my patients and I tell them, please be patient with me. I'm running a little behind. I have a patient still sitting, whether it be they're bleeding, whether their blood pressure is low. I just have a situation that I'm trying to take care of, and I'll be with you as soon. Can you just be patient? I'll be with you as soon as possible.
Okay. Um, Let me ask you, Tiffany, concerning patient safety conditions. I mean, not where you work, but just throughout your career. Have you ever seen or noticed any unsafe conditions in units that made you like say, "Wow, I'm not coming back here"? Like for instance, have you worked somewhere else on a per diem basis and
Hmm.
saw the way things were going and just something didn't feel right to you?
Yeah, I have. I
Okay.
have.
Okay. Now let me ask you. Now this is a big concern that's been happening in Baltimore and other states, and that's the outbreak of bed bugs.
Hmm.
Have you ever had that at your facility to deal with that?
Yeah.
Okay, okay. No, I mean, I worked at several facilities that had bed bug infestation, and this is something that just kind of like came out of nowhere, years ago, and now it just seems like it's a um, common
Hmm.
problem. And I
That's
mean,
it. When we found the problem, we took care of the problem, and the problem was solved. We've never been at a point where we were infested with it. If we saw it, they was on it, bam, sure the patient was taken care of, like making sure he had the proper treatments going on at his home to make sure it was
okay,
taken care of, and also our facility. We've never had the point where we were infested. I've never seen an infestation
right,
because
right.
anytime we did it, caught them right away.
Okay, okay, that's I hear you, and that's
Mm-hmm.
basically what you need to do is catch them and take care of it as soon as you
Mm-hmm.
see the problem. Um, and I don't know how with more people coming on dialysis, um, how are we going to keep this contained? Patient safety. What does safe
Mm-hmm.
dialysis look like? Let me just ask you from a technician point of view, what do safe dialysis care look like to you?
Safe dialysis care is, um, to me, is being respectful to your patient, giving them the quality care that they deserve, because this is their life in your hand. That education has to do with safety, just giving them the quality care. And if a problem arises and they need you, we need to be attentive to them. We need to make a patient feel safe when they come in for treatment, because their lives are in our hands.
Absolutely. I agree with you. I agree with you 100%. Um, do Have you seen an increase of dialysis patients?
Um, not really, because I haven't, not because of where I'm working at, I haven't seen like an increase.
Really?
Mm-mm.
Even the facility where you work at, the patient census, you haven't seen just like a spike of new
No,
dialysis patients?
you know how dialysis goes. One part of the year, your census might be low. The next thing you know, year, the census is going to go up. And to
Right.
me now, around this time, I think the census is about to go back up.
Okay. Okay. Um, as a caregiver, can you share what was the most traumatic experience you witnessed as a patient care tech?
The most traumatic experience was years ago when cardiac arrest while on the dialysis machine.
I'm
And
sorry.
then I said witness go into cardiac arrest while on the dialysis machine
Wow.
and having to administer, CPR, get them out the chair. And mind you, they still hooked up to the dialysis machine. So you're trying to get them rinsed back, get them out of the chair, get them on a flat surface and administering CPR.
Wow. Is that tough? I mean, is that exhausting after?
Yeah, it is. It wears you out.
Wow. Let me ask you this. Do you see more units being built from your experience?
Yeah,
You do, but you don't see an increase of
yeah.
patients?
I don't. I see more units, but see, I don't see everything. I mean, I can see units being built, but I don't know what the census is in these other units. When I say I don't
Gotcha.
see a rise, because I'm particularly speaking of where I'm. Well, of course,
Mhm.
if there's other units going up, then there must be a spike in people needing dialysis, and it's
Okay.
more of African American. I mean, you find in some other, nationalities that you dialysis, but it's more African Americans who are going on dialysis.
Oh, absolutely. Absolutely. I attest to that. Most definitely,
Hmm.
especially here in Baltimore City and other urban
Hmm.
cities across the United States. Um, and that's why we're trying to raise this awareness. And even
Hmm.
just having you on to give individuals a sense of what some caregivers go through, especially caregivers with 20 years experience as yourself, and that, you know, these caregivers are kind of phasing out. I mean, you can't do dialysis 34. I mean, you can do it 40 years, but I mean, like you said, more the younger generation is coming in, and it's kind of phasing the older generation, like myself, out
Hmm.
of the picture, where companies don't want to pay you what uh, they used to
You
pay.
deserve to get right,
Uh,
or what you deserve to get paid.
oh, absolutely, absolutely, and that's another show in itself. But
Hmm.
caregivers in this field do not get the amount of income that they should be getting as caregivers, and shoulder and bear a lot of burden,
Hmm.
doing this position, working
Right.
long hours. I mean, on their feet all day. I mean,
Right.
it can be really, really exhausting. So I
Right.
know you you was going to be here for a short period of time because you got to get up early. Um,
Yeah.
so I was waiting for our next guest to hop on. She's not going to hop on, so I'm going to have to wait till she comes. But I definitely appreciate you being on,
You're
Tiffany, and giving
welcome.
us a perspective from the healthcare giver perspective. Anything you want to say to any patients undergoing dialysis, any reminders or just anything you feel that needs to be broadcast to people who are receiving dialysis, who are getting ready to start dialysis? What would you like to say to them?
First of all, I would like to say, please watch your fluids. If the doctor tells you that you can only have a certain amount of fluids in between your treatments, please watch your fluid intake. Follow the directions of your dietitian. Do everything that they tell you to do. And if you follow the rules or the guidelines that they give you as being a dialysis patient, believe me, your life will last longer.
All right, all right. Tiffany Hawkins from Baltimore, Maryland. Thanks a lot, Tiffany, for
You're
coming on.
welcome. You're
All
welcome.
right, take care.
Bye
I'll talk
bye.
to you soon.
All right, bye
All
bye.
right. So yeah, so well, we had some technical difficulties with my partner and the camera, so that's why you don't see her on here tonight. But she's in out there in the audience, watching and supporting the cause. And one thing that Tamika said that I want to put up there is that they technicians have a cap in their pay. So that's why we don't get paid like we should. Even the nurses, they only pay us so much, and they're not going to go even more than that. Same with technicians, and what Tiffany was mentioning about the younger generations throughout the United States. I'm not sure if that's happening in other urban cities where the younger generations are being hired to do this work. I mean, it's not everyone, but even I've seen where the new generation of caregivers, when you have the technology and the cell phone, so once they may put their patients on treatment, then they'll go and sit somewhere, sit behind the desk, but not be in actual uh, vision of the patient that they've been assigned to, and they're on social media. So if the machine goes off or alarming, it may take up to 8, 9, 10, even more than that, seconds to reset the alarm. And they may not be thinking the importance of resetting the alarm as soon as possible, because if an alarm goes off and the blood is just sitting, the person's blood can clot. Now, I've been in many situations where I worked at facilities, and as a charge nurse, I may had to go check the water or go to attend to somewhere else. And when I come back, I hear alarms going off and nobody's around. That's a problem. That is a serious problem. And it does happen. I'm not going to sit here and pretend like that it doesn't happen. It does happen, especially in larger units. I'm not saying that this is a major issue throughout the United States in every unit, but I have seen issues in units that are valid. And Donnell Carley, he mentioned yes, or gone on lunch break. You have technicians who may go to lunch and just walk off the floor, may not give a report, may not tell somebody what's going on with their patient, and they just go off the floor. Yes, this happens. No, I'm not bashing the caregiver industry or dialysis, but I do have to speak on the issues that are common throughout a lot of dialysis clinics. Now, there was an article, and I can't think of the name of the article, but Dave White was in it, and it was called Dialysis Scam, and it was done by a Washington magazine or newspaper that talked about the issues of kidney dialysis in urban cities, one in particular, Washington, D.C. Let me tell you, these are valid complaints, as I mentioned in the beginning of the broadcast. These are some of the complaints, and if you're listening right now, please share what you may experience if you hear something off this complaint list that other people have experienced at dialysis facility. Please speak out on our feed right now. And here are some of the complaints that patients have definitely experienced in dialysis facilities. One, treatment shortened due to lateness, which may not be no fault of their own. So you could be on your way to treatment, your car could break down, you could run out of gas, the bus is late, you missed the bus, any other type of issue could go on, and you may run late for third shift. Let's say third shift starts at 3 o'clock, and you get there at 3:30, 4 o'clock. A lot of units are going to cut your time and say takeoff time is at 7. And if you run 4 hours or 4.5 hours, you're not going to get all that time. You're going to get the time that you got there. If you get there at 4, you're going to run 3 hours. They're going to better bet they're going to take you off at 3 hours because people are tired. They've been there ever since 5:30 and they want to go home. That's just the truth. And is it right? No, it is not right at all. No one's time should be cut short because they was late of no fault of their own. Period. The second one that's a valid complaint, fruit flies and gnats due to pretty much the biofilm that is in the drain. Okay? And what happens is the waste and the solution and all that comes out of the dialysate hoses and the waste goes into the drain behind the machine, then it starts forming this biofilm down in the drain, and that's where these gnats come from. I'm sure you've seen them. I've seen many dialysis groups that talks about them. So that's happening, and most of the time it happens in the summer. This, my partner Tamika says, and the smell that radiates from these drains. Again, we're not here to demonize or condemn units, but to shed light on what some patients may experience. Not all facilities have them. I'm sure the facilities out in the suburbs don't deal with a lot of these issues like the units in the city. Um, just to share one experience that I witnessed firsthand and other technicians experience with one major corporation in East Baltimore, Maryland. Renovation was being done back in 2012, 13, somewhere between there. And they did renovation while the patients were coming in for treatment. They would do the renovations at night, and you would see the remnants in the morning. And on top of that, they took up the whole clinic floor, and there was nothing left but the concrete slab for 6 months. Who does that? Have patients come into a unit with the concrete slab of the floor and do your treatment. So if someone bleeds, how are you able to clean up the blood from concrete? You had dust on the television stands, on the chairs, on the medication cabinets, on the components. It was a total mess. But yet, 99.9% of patients in this facility were African American and Medicare, Medicaid recipients. Now, another valid point of patient complaints are patients not properly being monitored, i.e., staff on a cell phone or not in the area where the patient is. This is another common problem that needs to be addressed. 5, I've heard stories of patients being belittled because they was late or something that was no fault of their own. As I can't remember, oh, Don P. Mormon said patients, that caregiver treat patients as if they were sick all the time. You know, they don't see beyond that. And that may hold true for a lot of people. Another one, staff not washing hands between patients or after touching the machine or after giving catheter care or after initiating treatment. Infection is the number one, it's the leading death in patients in the unit is infection control, not washing your hands. Another concern, a complaint is staff not responding to machines in an appropriate time period. If your machine goes off, if you don't know how to reset it and no one's in the area, maybe someone went to go get supplies, someone went to the bathroom while somebody else was on break. It could be many things that could pull someone out of the area where they should be monitoring, and they're not, and the machine goes off. If the blood is just sitting for a long period of time, that's a high risk for that blood, that whole circuit clotting. So we definitely need to be mindful. And another one that I'm not sure if anyone experienced this. If you have, please share. Is at the end of treatment, you may be bleeding at the end, and they move your chair out of the station and put another chair there and put the next patient on while you're still holding your sight or you're still trying to recover from whatever issue you may have encountered during your treatment. So these are some of the complaints that patients have voiced on paper, on the internet, in the chat groups, and here at Urban Renal Talk with Tamika and Steve, we felt important to raise these uh, issues and especially try to find out what safe dialysis care look like. Again, um, my partner says just like staff, patients also need to wash their hands. That's very true. If you're a patient that goes to an outpatient dialysis unit, you definitely need to practice infection control and washing your hands, especially if you're going to do any type of access cleaning. You need to clean your arm with soap and water. They should have sinks provided at the unit. Once you do that and you go to your station, you should be cleaning your access site with the alcohol or the prep that they have. Uh, I may say that some of these pre-prep little small alcohol pads that soon as you tear them open, they just rip apart. I definitely understand that. But the main thing is washing your access either at home or at the unit at the sink with soap and water. That's very important that happens. Um, we're getting down to the end of the show. I was supposed to have another technician on from Oklahoma City. Courtney, I'm sorry that you couldn't come on. Not sure what happened, but we're definitely going to catch you next time. This is part one of a two-part series of safe dialysis care. What does it look like? Next week, we will have Donnell Carley from Georgia on here. He's going to share his experience of what he experienced as a patient on dialysis that almost led to him leaving this earth. The gentleman has a story to tell. He's a three-time, not two-time, but three-time transplant recipient. He had multiple issues that almost put him at the brink of death as a result of negligence at the hands of staff at the facility that he attended when he was on dialysis. So he would be on here next Thursday to share his incredible story. My partner says at the unit, and please do not put lotion on the access arm prior to treatment. Absolutely. We're going to go over time for a second. Absolutely. Please do not put any type of petroleum-based lotion, cream, any type of cosmetic on your access arm before coming to treatment. Just soap, water, and your ashy skin or dry skin without any type of emollient on it or lotion or cream, because that right there again could add to the infection when we cannulate or put the needle in your arm. Once you have that exposure to your bloodstream and to whatever access you have, mainly a graft because it's a man-made material, and grafts are subject to clot, not only clot, but get infected more likely than the fistula, because the fistula is your own vein, but the graft is a man-made tubing that's in your arm, and that's a foreign material, and so that is a high risk for clotting. I want to see what Donnell Carley said. Interesting story he will share with us next week. Oh, this is a long one, Donnell, but Donnell says untrained techs or nurses, it happens. Some of them don't care either. Some of these centers have really gone down for me since 1979. No precepts to train the new hires, and this can certainly cause deaths, but it happens. Most patients are low income and minority people, and no one to speak up for them, causing deaths, and the list goes on and on. Okay, and Donnell says he had a stroke by a, okay, I had a stroke by an untrained LPN that had a problem teaming after being trained. She was just slow, rushing, trying to do changeover that morning. I became paralyzed from air embolism for neglect for over a year and could not speak. No physician was available or no head nurse was there. Wow. I want to read the rest of this, but Darnell, no more. We need to say this for the show. But then he goes on to say, uh, no physician was available or no head nurse was there. This almost sounds like this happened at night. Yeah, it could have happened during the day, but it sounded like it happened in the evening with none of these individuals there. They did not write it up. That was a big no-no. No incident report, especially internal incident report, should have been done. Um, then he says, um, and I write it up, but once after a year, I spoke up and they were shocked I could speak. And the doctor said I had a seizure, but I took them to court and it was neglect and not reading protocol. Wow. Wow. Unbelievable. Unbelievable. Now, I'm just going to stay on a couple more minutes because Donnell made some really, really good points here. He talked about person rushing. She was slow. She rushed. That's a big no-no in this field. You can't rush doing this. However, some companies create that environment for you to rush, whether it's the hurry up, get 'em on mentality, or they want you to run 4 shifts. It could be any amount of situation that's created to put you in a position where you feel like you got to hurry up and get the patient on. And it goes both ways. Again, I got to tell both sides because I've seen both sides. And I've been in situations as a charge nurse where we legitimately had issues in the unit, legitimate issues. The water treatment system is down. The station is not working. The machine, something that may cause a delay from the normal norm of putting on. And as I go out to inform patients on the issues, I am bombarded with so many questions, frustration, anger, all directed at me, but no, it's all directed to the management or to the corporation, but I'm the one getting the brunt of the patient's complaints, their dissatisfaction, the cussing, anything you could think of on why the treatment was derailed or delayed. I'm getting the brunt of it, not the management, not the administrator who is still in the bed, not 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 the people up in the higher link of these organizations. So please just bear with us when the nurse comes out and legitimately explain to you that something's wrong. They really mean it. When they don't come out and they keep you waiting and you don't hear nothing, then that's when you should start to get concerned on why no one's come out to explain the situation that's causing delay of treatment. And then once your treatment is delayed because of no fault of your own, then your treatment sometimes get cut short because the clinic is running late. Why should your treatment get cut short of no fault of your own? So Donnell Carley says, where are the patient reps? Every clinic needs one. The link between the caregivers and the patient. And he's right. Darnell, you are absolutely right. I don't see patient advocates or reps anymore. Tamika, my partner, would tell you this. We just don't see it anymore. I don't know why this is not happening. I don't know why that's not being promoted even more, because you're right. That is the link. That is the link. And I don't know why it's not being uh, uh, advertised or I can't think of the word I want to use, Donnell, but I just don't know why this is not happening as it used to happen. So I agree with you 100%. So yeah, so let me go ahead. This last one, I'm about to sign off. This has been a great show. Please share this. Please share it because this is very important. We just don't talk about this type of topic of what's going on in clinic, but things that are important pertaining to kidney disease, whether it's in the dialysis unit, whether it's transplant, whether it's the urban food desert, whether it's hypertension, whether it's diabetes, whether it's lupus, whether it's kids over in Cameroon dying because they don't get 3 treatments a week like kids over here. Kids over Cameroon get 1 to 2 treatments every 3 weeks or every 2 weeks. Who does that? Okay, not any fault of their own. Kids are dying. 850 million people are affected worldwide by this disease, and you wonder why it's the 9th leading cause of death, yet no one is talking about this or getting loud on main media or commercials where you see about hypertension or diabetes or kidney disease. But 850 million people do some form of kidney dialysis worldwide. So until next week for part 2 of Safe Dialysis Care, what does it look like? And we will have guests, 3-time transplant recipient who was on the brink of death, paralyzed, and unable to talk, Donnell Carley. We will see you next week, Urban Renal Talk with Tamika and Steve. Good night, everyone. Thanks for joining us.